Hello, everyone that's joining us for the pre-health session. If you joined me previously before for the Harper session or the pre-law session previously, welcome back. We will get started in about a minute or two. Okay, I think we can get started. Thank you everyone for joining me for this session. If you see me previously before the Harper session, the pre-law session, welcome back. Again, my name is Alexander Ma. I am one of the admissions counselors at Binghamton University. I am regionally based down in New York City, and I work remotely for Binghamton all year long before the pandemic and all that not so fun stuff. Today, joining me is our pre-health team, which will talk to all you about what that means to be pre-health and all different programs that encompasses. And presenting today is Evan Mills. So Evan, if you want to introduce yourself and your team.
Yeah, absolutely. Thank you, Alex. So hello to everybody. Thank you for joining us for the pre-health session today. I just wanted to introduce myself. My name is Evan Mills. I'm a Harper Academic Advisor and a pre-health advisor with Harper Academic Advising. I'm joined today by Dr. Langhorn, who is the Director of Pre-Health Advising at Binghamton. And I'm also joined by our Assistant Director for Harper Academic Advising, Jenna Whitaker, who is also a pre-health advisor. And so we want to talk to you today a little bit about how our pre-health program is unique to Binghamton and some of the flexibility that it offers. Okay, and so what is pre-health? So it's an umbrella term that we use at Binghamton for students who might be looking to pursue a graduate program in healthcare of some sort. So there's a lot of fields in healthcare, of course, and we have 12 tracks at Binghamton, pre-health tracks that you could engage in. So those could be things like pharmacy, medicine, of course, if you're thinking about med school, dentistry, optometry, veterinary medicine, podiatry, physician's assistant, chiropractics, dietetics, nutrition, physical therapy, occupational therapy, or public health. So you might be familiar that with some other schools that have pre-med majors or perhaps a pre-dentistry major. At Binghamton, pre-health is not a major. It's actually just a select track that you can engage in, which will prepare you for graduate level study in healthcare in any particular fields, okay? So during your freshman and your sophomore years at Binghamton, you would work with the pre-health advising team. So these are our pre-health advisors. We have 8 pre-health advisors, and then Dr. Langhorn would work with you during your junior and senior year to help you begin to put together your applications for med school or for pre-PA school. One of the strengths of the pre-health program at Binghamton is it offers a lot of flexibility for you. And so you could, for instance, be an art major, but then also be a pre-health student. So we have had students who want to study art, but then they're also going to do all of the coursework that they need to get into a med school. And that is a little bit more work. It's sometimes something like doing a double major, but it does offer you a lot of flexibility. You're not locked into being a pre-med major in the way that you may be with some other schools' pre-med programs. Okay, so what exactly do our pre-health advisors do? We do academic advising and pre-professional advising for you. So from the very first day that you would walk into Harper Academic Advising, we would talk to you about what your goals are, both your academic goals for your time at Binghamton, but then what do you want to do later on in your career? What do you want to do with your life? Do you know that you want to go to med school? Do you want to get into a particular type of medicine? Do you want to go to dental school or become a PA? And where and when and how do you want to do that? We'll talk to you about all of those things and try to set you up with some sort of plan or some sort of schedule for how you're going to accomplish those goals over the next 4 years. We also offer a lot of pre-health related events and workshops. So we have speakers, a lot of Binghamton alumni who are going to come to campus and talk to you about their preparation for going to med school or going to dental school. At Binghamton, we'll have a variety of different physicians come in who might talk to you about, what their work is like, how their work has changed over the years, how their career has developed. And then we also have some workshops. We have workshops for freshmen, for sophomores, to help make sure that you're preparing for your, you're just getting all the requirements that you need and preparing you for med school in a timely fashion. So we also have a lot of scholarship and internship assistance. We publish a big list every year of lots of internship opportunities, scholarship opportunities for you to engage in clinical settings, to work with a doctor, or maybe job shadow with a doctor, or a dentist, or a physician's assistant, and get to learn what their job might be like. And then we also have a physician mentor program at Binghamton, which is managed through the Harper Edge office. And so this physician mentor program works with a lot of Binghamton alumni. And what it does is we pair a Binghamton student with a Binghamton alumni or alumnus, and they get to work with that person throughout the course of the summer, whether that person's a dentist or a physician or veterinarian, maybe perhaps even. And just see what their work is like. So you can gain a lot of clinical experience. You can have the kind of that close working relationship with an actual professional who's working in the field that you're interested in. And that can be a really eye-opening experience and a really nice program for our pre-health students. Our credentialing and application assistance, that is something that Dr. Langhorne works very closely with students on. And so he's going to work with you during your junior and your senior year to talk about, which programs you might be interested in, how you can prepare those applications, what the deadlines are, what are some factors that you might want to consider as you're putting together your application, and make sure that you're kind of sending out the best package possible for your application to any healthcare graduate program. We also have peer advisors who work with our pre-health students. So we have a student advisory committee, and these are fellow students who've gone through the process of completing pre-health courses, maybe doing some internships, or even they're in the process of applying to professional schools or graduate healthcare programs themselves. And so they really know some of the most up-to-date information. We work with these students. Dr. Langhorne trains them. They have weekly Zoom hours right now. Hopefully, once we're back to normal, they'll have weekly in-person hours as well. And these are our peer advisors, our students, but they're also, advisors in the sense that you can really work with them and learn from them. So there's a lot of people who are available for students to connect with, to get their questions answered as their pre-health students at Binghamton. And so we have, of course, our pre-health team, junior and senior year, and then we have our pre-health peer advisors, and of course, Dr. Langhorne, who's going to help you really kind of put together the application and work with you on some of the credentialing and recommendations and things like that need to happen during your junior and your senior year. Okay, so I know we have a live Q&A session right now, Alex, is that right?
Yep, that is correct. Let me stop sharing your screen. We're both on camera. Yep. And usually, traditionally in the past, when we hosted this pre-health session, we are usually bombarded with a ton of questions who are interested in pre-health. So again, for all of you listening right now, any question you might have, feel free to drop in the Q&A box. Evan or myself or Dr. Langhorne might be answering them for you. So a couple questions did come in so far. So does the pre-health track include a nurse practitioner program? Like, do you help those students looking to study to become a nurse practitioner in the future?
Yeah, so nurse practitioner programs, those we have at Binghamton, we have the Decker School of Nursing that focuses on students who are interested in a career in nursing. We don't have a track within pre-health for people who want to be a nurse practitioner, okay? That would probably be something that students you could work up to through nursing studies. There's some nuance between a nurse practitioner and a physician's assistant. They both have pretty similar roles. I would say that the nurse practitioner is probably a little bit more focused on palliative care and kind of long-term care, perhaps, than a physician's assistant might be. But if you are interested in that, we can certainly talk with you about how you could make that happen during your time at Binghamton.
Gotcha. Great. Thank you. And another question came in is kind of, are there any kind of requirements to join the pre-med or pre-health program at Binghamton? Are students that are in the pre-med program like really competitive against each other, or they're willing to help and learn from each other? And lastly, are pre-med classes hard compared at Binghamton compared to like other universities?
So I would say we'll kind of go in reverse order here, if we will. Your pre-health courses are going to be challenging. A lot of biology, a lot of chemistry. It is a challenging thing to get into, and but we do have a lot of students who are very successful doing it. So if you're committed to it, I feel confident that you can succeed. You're being accepted to Binghamton because we know that you can succeed in these things. And I would say, yes, it's challenging, but if it's something you want to do, give it a shot. Okay. Is there a lot of competitiveness? I don't think there's a lot of competitiveness between students. I think that what I see, at least among our pre-health students, is that they're very supportive of one another. And some of that is our peer advisors that we have. They're very happy to work with each other, work with other students to kind of bring them up to speed on what they should be thinking about, what they should be doing over the next couple of years. So I see a lot of study groups in the library, students working together, our peer advisors. I don't see a lot of competitiveness or hear about competitiveness at Binghamton.
Great, thank you, Evan.
Yep.
So the next question actually might be for Tom, and we always get this question in all of our pre-health sessions, is what is the matriculation rate to medical schools from the pre-health track for students identifying as pre-med, and is there an average MCAT score that Binghamton students score?
Okay, the matriculation rate for 2020 was 60%. And the average MCAT was about 510. It's like 509.7 or 8 or something. And it's only, that's what the program does to it that does the analysis, but the scores are only reported in whole numbers. So I just round that to 510.
And as a follow-up, is there a med school that most Binghamton students prefer?
Well, I don't know what they prefer, but in 2020, the one that most of them got into was Upstate Medical in Syracuse. That had the largest incoming class from here in a number of years.
And speaking about Upstate Medical Center, I know we do get this question all the time. Can you speak a little bit more about the early assurance program that we have at Binghamton with Upstate Medical and the other medical programs we have?
Okay, so we have an early assurance program with Upstate Medical that you apply to at the end of sophomore year, and you do an abbreviated version. You do an abbreviated version of the application process and everything, and they will, if you're selected, they'll interview you the summer or the end of August, right before you start junior year, and you'd find out within a few weeks of that. And as long as you maintain a certain GPA and score a certain level in the MCAT, you're just guaranteed a space 2 years later in the incoming class for Upstate. So that's quite an old program. It's proved fairly popular over the years. We have a newer one that's just started this year with Lake Erie College of Osteopathic Medicine, and that has just, that is a little bit different. You get into that directly out of high school or as a freshman. Those are the only two admission options. And it's, once you're in, it's very similar. You have to maintain a certain GPA. I mean, they look at your SAT scores coming in. You have to maintain a certain GPA throughout. The only extra thing with that one is you don't have to take the MCAT as long as you've maintained the required GPA that they ask of you.
Great. Thank you, Dr. Langhor. This one goes back to probably for Evan. Are there a lot of research, internship jobs, and volunteering opportunities regarding pre-health at Binghamton or in the surrounding area?
Yeah, we work to publicize as many research opportunities, internships, volunteering opportunities as we can to students. I believe there's quite a few in the Binghamton area. And there's quite a few around the country. So I mentioned earlier in the presentation, we publicize a big list of this. You can actually find that list on the Binghamton PreHealth webpage if you look under the resources section. And it's a pretty exhaustive list of opportunities for PreHealth students in terms of kind of more clinical, practical experiences.
Great, thank you. And kind of follow up on the research release, what are research opportunities for freshmen who have experienced science research back in high school? So can you talk a little bit about the different research opportunities available on campus?
Yeah, we do have a program that we call FRI, which is the Freshman Research Initiative, and or Immersion rather. And that is for freshmen who do want to get involved in research right away. And it allows you there's a couple different tracks that you can go down depending on what your academic interests are. That's something you could definitely get involved in as a freshman. In terms of doing research as a freshman at the undergraduate level, it can be hard sometimes as well. Because if you're looking to work with a professor in their lab, often you need some kind of upper level coursework, you need some upper level bio, and you really need to have a foundation in the kind of basic biology and chemistry before you can take some of those upper level bio courses and just have the knowledge to work with a professor in the lab. So those opportunities for freshmen are there. Most students who are doing research are doing it during their, I would say, sophomore or junior year. And that's, I think, probably the better time to do the research because, again, you have I think it's going to be probably more fulfilling and it's going to be better for you in the long run because at that point you will have a foundation in kind of basic college biology and chemistry that you need to kind of work at a higher level in an area that's might be more pertinent to graduate level study.
Gotcha, thank you. A question that I just saw a minute ago was, are there any classes you recommend for high school students to take to prepare them for pre-med or pre-health, such as physics or any type of science or any other type of class?
Let's see. For high school students, physics isn't something that you need necessarily. You can take it if you want to. You do have to do some college level physics for med school, for dental school as well. It depends on what you want to do would be my short answer, I guess. Again, we have 12 different pre-health tracks, so depending on what you're planning on doing, I think I'm talking to probably a lot of students who are interested in med school, but if you're interested in being in a PA program, for instance, you don't necessarily need to do physics, okay? And so it really depends on what you want to do for graduate level study. I don't think that there's any real courses that you must do in high school though. So you can come to Binghamton without having done, college level biology or chemistry in high school and still graduate on time and complete all the requirements that you need to get into that graduate healthcare program that you want to get into.
Great, thank you. Is there a major that pre-med students at Binghamton prefer to have over other majors?
Yeah, I would say that most of our pre-med students major in one of three majors. Probably the most popular is going to be biology, followed by neuroscience, and then maybe biochemistry after that. Okay. Some students are doing psychology perhaps, but those are the three most popular. Again, the flexibility of the pre-health program is that you can major in anything. So we do have students who are studying English or political science and who are also doing all of the coursework that they would need to get into a graduate healthcare program.
Gotcha, thank you. And is there any way that your office or are there any other resources on campus that help prepare students for the MCAT?
I'm going to defer that to Dr. Langhorn, who's going to work more with students kind of at that time as they're going to take the MCAT. I don't know that we have any on-campus prep courses, but there's definitely prep courses out there. And I think that's one area that perhaps the peer advisors could be helpful with as well.
We don't offer any on-campus preparation for any of the standardized tests for any of the professions. There are, as Evan pointed out, there are plenty of courses available. They're all online in various capacities. And then, of course, our peer advisors are going through this as well, and some of them have taken, different preparation courses and so forth, so they could talk to possibly if you had questions about their experience with a particular course or what they thought was good or not good and so forth. At some point you could talk with one of them, but we don't have any kind of campus-based preparation for any of the standardized tests.
Thank you, Dr. Langhorn. So assuming that, a question that came in with the registration is, if I am currently undecided at Harper College, can I still go into pre-health? Is there kind of like a timeline where I do have to decide if I want to join a pre-health program or go into a graduate level grad school for health?
Yeah, I think there is a timeline. I think it would be a good idea to meet with an academic advisor probably during your orientation session and talk with them about your interest in pre-health, because although you might not need to declare a major right away, there is some coursework that you should get started on right away, the introductory chemistry being the most important sequence. So that's definitely something that you would want to start with your first semester at Binghamton. Is probably chemistry 104 or 107 perhaps, and make sure that you're working on that. And you can take a little bit of time to decide on exactly what major you might want to have, but there are some courses that I think you should begin working on right away. And that's, you could do perhaps maybe intro chemistry first semester here, and then maybe a biology course, and then work on some other gen eds or take some other exploratory courses during your first semester. But it is good to have a sense of wanting to begin the pre-health coursework, because it's better to start early on it than put it off until sophomore year.
Great, thank you. Can you talk a little bit more about the pharmacy program at Binghamton? Does that go through Harper College? And can you also talk a little bit more about PEEP too?
I'm sorry, I missed the second part of the question, Alex.
Yeah, can you just talk a little bit more about our pharmacy program at Binghamton? Also, can you talk a little bit more about PEEP?
PEEP, yes. So we do have a pre-pharm advisor as well, and we have a PEEP program, which is kind of a early admission program for students who might be interested in pharmacy school, where you would do either 2 or 3 years at Binghamton as an undergraduate student and then go directly to pharmacy school. That program is a little bit unique, and that's something I would recommend working with an advisor on, really beginning at orientation. There's a lot of different ways to get into pharmacy school. You could do 4 years as an undergraduate student and then go to pharmacy school. You could do something like our PEEP program for a couple of years and then go directly to pharmacy school and get a pharmacy degree. So it depends on what you want to do. If you want to have a traditional undergraduate experience, I would say, you may want to earn that Bachelor of Arts or Sciences at Harper, at Binghamton, and then perhaps go on to a pharmacy school. If you really want to get into the working world as soon as possible and be done with school as soon as possible, we could look at a program like our PEEP program to help you kind of get that pharmacy degree as soon as possible.
Great, thank you. So this might be a general question, actually, that could actually be answered for any type of student coming to Binghamton. If students take AP biology, physics, chemistry in high school, can they skip introduction of physics, biochemistry for pre-med?
They can, depending on how they score on those. So we have an equivalency table on our website, and certain scores will allow you to skip those, and certain scores won't. It really depends on how well you do on each of those exams.
Great. And just for everybody on the webinar, generally a 3 or higher will count as college credit at Binghamton on your AP exam. And then another question that came in through with registration, can you talk a little bit more about the pathway for students if they're looking to become a PA, a physician's assistant?
Yeah, absolutely. So if you're looking at becoming a physician's assistant, the coursework is very similar to the coursework that you would need for medical school with a few minor exceptions. You don't need physics, but you do need a year of introductory chemistry, a year of intro bio. You need to do some upper level microbiology. You need to do some upper level biochemistry as well. And it's very similar. It overlaps pretty well with a bio major or a neuroscience major.
Gotcha. Thank you. So this question actually goes to Dr. Langhorn. Or if you know, around how many students start off at pre-med at Binghamton and how many graduate as a pre-med student?
Okay, I don't know what the starting number is because I don't, I'm not involved with freshman orientation. My colleagues, 8 members of the advising team are involved with the first year orientation. So I don't have a sense of what the head count is coming into that. We have at the end though, we have between 145 and 170 students each year applying to med school. Now I would say probably 25 of those might be reapplicants from an earlier time. So, you'd say, well, maybe, 120 to 140 are actually, current seniors that have gone all the way through. But unfortunately, I can't provide you offhand with the orientation numbers for what the incoming freshman class looks like in terms of just numbers of students.
Great. Thank you, Dr. Langhorn. We are almost coming to the end of our time. Are there any last minute questions that you want to ask either myself or Evan or Dr. Langhorn? Okay, I don't see any new questions come in. So I think this is where we're going to wrap up for today. Actually, one question came in. Does pre-health require any kind of math? Math is required at Binghamton for all students. So that's going to be part of your general education requirement. Whether you're pre-health, pre-law, or any other major at Binghamton, you will require some type of math. And I guess I'll close out there. So thank you, Evan, for presenting to our group today and answering in the live Q&A. Thank you, Dr. Langhorn, also participating in the Q&A, and everybody supporting on the back end. We look forward to seeing your application when the time comes. We're going to have many other sessions throughout the month, so be sure to check those out. Thanks, everyone.